Good evening, everyone. I am your host, Brother Kelvin Ampofo, the immediate past. That's right, immediate past. Second District Representative of the Omega Psi Phi Fraternity Incorporated. I want to welcome you to our monthly series on health and wellness. This month and moving forward, we're changing things up a little bit. We want to focus on the health and wellness of the people in our community. And so with that being said, we have additional doctors joining us tonight. I want to make sure that you tell a friend, log in, listen to this information as it relates to health and wellness. And most importantly, ask your questions. Any questions that you have, use the chat feature. We want to make sure that our community is up to speed as it relates to the health and wellness of everyone. So with that being said, I'm going to introduce no stranger to us, the chairman of the Second District Health and Awareness Committee. This is Brother Dr. Jedan Phillips. Dr. Phillips, good evening to you, my good brother.
All right, good evening to you as well, brother. Immediate past
That's right.
District Representative. Well, again, as you said, my name is Jedan Phillips. By trade, I am a family doctor, also a medical administrator at Renaissance School of Medicine at Stony Brook University. I am also the Second District Chair of the Health and Wellness Committee. Our mission has always been one which addresses healthcare disparities, looking at issues to improve heart health and other chronic conditions that affect communities of color at a higher rate, also affecting and improving access to quality medical care, and also looking at issues involving mental health, just to name a few things. Now, unfortunately, the existence of these issues made our communities the low-hanging fruit, if I would say, for the COVID pandemic. And I think the numbers that we saw as far as the high mortality and morbidity rates have unfortunately revealed how vulnerable we are, but it also, I think, speaks to the work that we have to do. So as you stated, Brother Ampofo, as we look into this next phase of the Health and Wellness Committee, our job is going to be presenting subject matter that will help our community not be that low-hanging fruit the next time around if something like a COVID pandemic was to happen again.
Outstanding. We don't want to be that low-hanging fruit. So outstanding, Dr. Phillips. We're looking forward to tonight. Let me introduce the doctors that are joining us. Let's start off with, certainly, an addition, no stranger to us. As we know, we call him 78, Dr. Keith Boykin, retired pediatrician. Dr. Boykin, good evening. Tell us a little bit about yourself.
Well, good evening and welcome, everyone. Many of you know me from the COVID-19 webinar, but I'm also a board-certified pediatrician and fellow of the American Academy of Pediatrics. I practiced pediatrics for over 30 years before I retired about 3 years ago. But my passion is to continue to provide care to our community because there's so many things out there we need to take care of. So just sit back and enjoy tonight, and I will bring you all the pediatric perspectives, and hopefully you will enjoy what the other brothers and doctors will bring to us tonight. Over.
Thank you so much, Dr. Boykin. All right, so the first doctor I'm going to introduce that's joining us tonight, he's been with us before as well. Dr. Isabell comes to us, and he's going to share a little bit about his background and what he has to offer. Dr. Isabell, good evening to you, my good brother.
Good evening. My name is, once again, is Dr. Lee Isabell. I'm board certified internal medicine. I practice primary care mostly, as well as inpatient care. I deal with complex patients. I get my medical degree from New York College of Osteopathic Medicine. I did a year of traditional osteopathic rotation, and then I did internal medicine. And my philosophy, we treat the person as a whole. Thank you.
Thank you so much for being with us tonight, Dr. Isabell. Let's move to Dr. Ford. Dr. Ford joining us this evening. Good evening to you, Dr. Ford. Just make sure you come off mute so we can hear all those great things you got to tell us. Dr. Ford.
Yes, sir. Good evening. My name is Dr. Kevin Ford, and I'm a board-certified internal medicine physician and a fellow of American College of Physicians. I've been practicing internal medicine in Prince George's County, Maryland, for almost the last 30 years. I'm a proud graduate of Howard University College of Medicine and did my internal medicine residency at Howard University Hospital. I am the president of Ford Medical Associates, which is a two-person physician practice here in Prince George's County, Maryland. And I'm glad to be with everyone tonight, and hopefully we can give some good information.
Dr. Ford, thank you so much. He had to throw that HU in there. He just wanted to let y'all know HU in there. We're not gonna get into that because we got GE on here, so we're gonna save that for later. Dr. Plummer, good evening to you. Dr. Plummer joins us tonight as well. He's going to share a little bit about himself. Dr. Plummer, you have the floor, my good brother.
How you doing? Good evening, everyone. My name is Dr. Christopher Plummer. I'm a specialist in maternal fetal medicine. I completed a residency in an OBGYN, and then I did a fellowship in maternal fetal medicine, practicing in high-risk pregnancies. I'm board certified in OBGYN and in maternal fetal medicine. My specialty is to reduce maternal mortality and morbidity. And thank you.
Dr. Plummer, thank you so much for joining us. See, ladies that are watching, we got something for y'all as well. It's not always about the fellas. You know, we're going to make sure that everybody gets taken care of as it relates to this health and wellness. Last and certainly not least for this evening, Dr. Wingfield is with us. Dr. Wingfield, good evening to you.
Hi, good evening. And thank you so much for having me. It's certainly an honor, a pleasure to be here. My name is Dr. Edward Wingfield. I'm an interventional cardiologist. I practice in Hamilton, New Jersey. I've been in practice here for the past 13 years. My specialty is interventional cardiology, as well as some general cardiology. I primarily specialize in coronary angioplasty, peripheral angioplasty. I do a lot of work with critical limb ischemia, which is blockages in the lower extremities. I also treat stroke patients with carotid artery interventions, as well as venous thromboembolism, which is pulmonary emboli. I also serve as the president of the medical staff at Robert Wood Johnson University Hospital at Hamilton, and also chair the Department of Cardiology. So very excited to be here and engage in this conversation. Let's get started.
Outstanding. Well, thank you so much, Dr. Wingfield. Thank you all, doctors, for being here with us tonight as we assist the brothers and sisters in our communities as it relates to health and wellness. Now, let me start off by saying, let me help the doctors out. All of the conversation that you hear tonight, all of the comments, those are the opinions of these doctors. All right. It does not necessarily reflect the views of the Omega Psi Phi Fraternity Incorporated or the businesses that our doctors may be affiliated with. All right. So with that being said, let's start with Dr. Ford. Dr. Ford, I'm just curious, as we transition into this post-COVID environment, what are some things that you think have occurred during the pandemic that now, as we move to the post-COVID times, we need to be mindful of, we need to be aware of?
Well, that's a great question. I think there's a couple of things that stand out to me. One, over the pandemic, the population has been more sedentary. We haven't gotten out and tried to exercise. People are working from home, not really moving around. And so we've gained a lot of weight, you know, me included. And so what happens is when you gain that weight, it affects a lot of different diseases. You know, we know diabetes, hypertension, increased cholesterol, so many things. Another thing that also happened is that we have lost track of some of our screenings, right? So screenings, we're talking about screening for colon cancer, screening for prostate cancer, women for mammograms, screening for breast cancer, even, you know, pap smears. So I think those are some of the things that we're trying to get patients to come back to the office to get back up on their screenings, which can help to save lives.
Now, Dr. Ford, and just bear with me. Some people, you know, when they hear weight gain, you know, can you elaborate just a little bit more? I mean, are we talking weight gain, you know, if somebody gains 5 pounds, 10 pounds, are you talking about obesity a little bit? Can you expand a little bit more on this weight gain and what people should be aware of?
Well, we know, you know, the ideal, we talk about BMI, body mass index, and ideally patients should be BMI of 25 or less. And so as your BMI elevates, then what happens is we know for patients with that are borderline diabetic, that may tip them over to being diabetic. Patients that have high cholesterol, their weight gain, they're probably not eating correctly. And that leads to other things, can lead to other like heart disease and strokes and multiple different medical problems, which I'm sure some of my colleagues are going to expand upon.
Well, you mentioned there, I think, a topic there that's near and dear to Dr. Wingfield when you mentioned the heart. Dr. Wingfield, can you touch on a little bit, weight, heart? Talk to us a little bit about that. Just make sure you come off mute so we can hear all those great things you're going to tell us.
Right. Absolutely. Thank you. So, one of the things that I point out to my patients is that obesity is kind of the tip of the iceberg. There's so many components or disease states that fall under obesity. So when we have a patient who has that BMI over 25 or over 30, it certainly puts them at much higher risk for diabetes, higher risk for high blood pressure, higher risk for elevated cholesterol, also blood clotting disorders and things of that nature. So obviously that is, I'm not going to say that the easy target, but it's a more of an obvious target where, okay, this person or this patient is obese. However, there are other components that we really have to take serious. And one of those is something called metabolic syndrome. And that's where we see a lot of our patients who are kind of under the radar, for example, may not be considered overweight, but there is a pretty significant criteria that we like to use. And most of it surrounds waist circumference. So depending on the waist circumference, in women, we're talking 35 inches in the waist circumference, men 40 inches in the waist circumference, along with elevated blood pressure. Typically, it's not high blood pressure, but blood pressure over 130, over 80. Also, we look at issues with their cholesterol profile. So these patients tend to have elevated triglycerides and a low HDL. So their good cholesterol is low. In addition to that, their blood sugars are also tend to be elevated. So this is kind of that smoldering syndrome that you have a patient who's not clearly obese, but this patient has multiple kind of smoldering risk factors. And that is what we see a great deal, especially in the African-American community, especially in Black men in that age range from 40 to 55. We see so many of us who suddenly die from heart attacks. There's a long list of us who suffered a tragic ending. And we see that with African Americans in heart disease. When we have a heart attack, it's more likely to be a fatal heart attack compared to any other subset of people.
Dr. Plummer, I'm just curious, Dr. Wingfield mentioned from the male's perspective, obviously from your practice, talk to us a little bit about your perspective as you come off. Yeah.
Well, obesity is a problem, just like Dr. Ford and Dr. Wingfield spoke about. But in pregnancy, when a woman is especially morbidly obese, it increases the risk of preeclampsia, increases the risk of gestational diabetes. It risks complications of preterm delivery, also them developing blood clots. And if they need a delivery by cesarean section, there's also complications in surgery, more of hemorrhage and issues with when you have morbid obesity. One of the things that during pregnancy we want to, express that there's no need for an extreme weight gain. A lot of people think when they're pregnant, they could just eat everything, and gaining weight is gaining a lot of weight during pregnancy is normal. Generally, for the average woman, no more than 30 or 35 pounds should they gain during pregnancy, and if they're really morbidly obese, they should gain no more than 10. So we just want to get that out there because, not everything people, it's also based on culture too, because a lot of people feel that, food is love, and just a diet and everything like that, increasing obesity just brings a lot of complications during pregnancy.
Interesting. We often hear the slogan, you have to eat to live, don't live to eat. So I think that ties in kind of what you're saying there. Dr. Isabell, share with us your perspective, post-COVID, things that you've seen, things that you're experiencing, things that you've been working with. Talk to us.
Okay, good evening. To add on what Dr. Ford said regarding preventive measures, during COVID, also it's what's called a Medicare wellness visit, 60 and up. A lot of patients didn't get that. What is a Medicare wellness visit? It tells the well-being of the individual. It screens for dementia. It just screens, are they safe at home? It just screens for fall, and it does all those preventive measures that we mentioned, colon, prostate. Also the mental well-being regarding anxiety and depression. And that's what a lot of patients, because that could be the screening. Also, we discussed regarding healthcare proxy or what we call advanced directives. I also do inpatient care, and a lot of times during COVID, people, loved ones are very sick. Do they need a vent? Do they need dialysis? They don't have any healthcare proxy, and there's a confusion who makes the medical decision, or what was the person's wish, or was it the family's wish? And I've seen that a lot. So all that is usually discussed with a Medicare wellness visit. And it doesn't just have to be a Medicare wellness visit. You can discuss that with your patient. Everyone should have a healthcare proxy. Thank you.
Dr. Phillips, certainly from day one, you've been here. You've given us information from the very beginning, right there at the epicenter. This transition now, as we move to this post-COVID environment, please shed some light for us.
Yes. I think, again, as the brothers mentioned earlier, I think one of the biggest things, I too am a primary care physician, is I'm seeing a lot of people playing catch up, catching up on tests, catching up on getting their medications refilled. One of the other interesting statistics is we're one of the one group that has one of the highest rates of even a person who's been diagnosed with hypertension, not on blood pressure medication. So you've got people walking around with elevated blood pressure. And there was a time where I felt like, it seemed that just as much as I was encountering people I knew that had COVID or died or complications from it, also was encountering people that were having complications from their diabetes because they fell off, complications from their blood pressure, strokes, heart attacks, kidney failure, another thing when you've got undiagnosed blood pressure. In addition to that, like it was said earlier, taking advantage of preventive testing, taking advantage of preventive vaccinations. But I think another big thing that people have sort of in falling away from their medical care has suffered in a way with their mental health. As Dr. Isabell said, when you go for these annual visits, especially an annual Medicare visit, they're going to be asking you things about how you're feeling emotionally. And I think we've seen a lot of people who are going through a lot of challenge during this time. So again, as far as COVID, still seeing people get COVID, still seeing, unfortunately, the similar statistics of the more significant outcomes occurring in individuals that are either non-vaccinated or under-vaccinated or under-boosted, who may be in combination with some of these risk factors, heart disease, obesity, some of the diabetes, just for example, some of the things we had talked about. But unfortunately, still those trends are occurring. And with that being said, also still seeing people asking questions about, should I get vaccinated? Should I get the booster? So I think that, in my observation, I'm still helping with some of the medical information that is needed to help people deal with the risk of COVID that is still here, but also trying to be encouraging and available so that people can catch up on what they missed out. And one way that they can catch up if they can't get in the doctor's office is taking advantage of telehealth, because a lot of our offices have that available.
That's powerful. That's powerful. As we talk about health and as we talk about wellness, we don't want to limit this just to adults. It's imperative. I know that there's parents on here that are worried about our youth, our children. So, Dr. Boykin, please talk to us about the kids. What are they possibly seeing? What effects or impacts have they gone through? And what are things we need to be aware of as we monitor our youth?
That's a very, very good question, because of all the things that my other brothers have already spoken about tonight, unfortunately, also affecting the children. We do know that if you have COVID as a child, you're not vaccinated, you have full-blown COVID, you're not vaccinated, you have increased risk for type 1 diabetes. So that's a new thing that we're seeing, and we're trying to understand that because more kids are being taken care of it. I think the youngest patient I ever took care of with type 1 diabetes was a 1-year-old. So that's pretty powerful. So we have vaccinations for our 6 months old and above. So hopefully that parents will consider that when they consider the possibility if your child will contract COVID, they could get diabetes. We also know that kids got more weight gain during this pandemic. And Dr. Wingfield mentioned the metabolic syndrome was something similar to that in pediatrics. Now our obese pediatric patients are developing what's known as type 2 diabetes, which is based on overweight and just as insulin resistance in the pediatric population. They don't have a deficiency of insulin as a type 1 diabetic, but they have the inability to use their insulin. So they're becoming type 2 diabetics. And so we have to address that issue. The other thing that Dr. Phillips mentioned was that, the preventative care. Well, the sad thing about the whole pandemic was that because of misinformation, the vaccination, anti-vaxxers became more irrelevant out there to some parents that were on the fence about vaccination. And as a result, the type of vaccinations and our proven pediatric or preventative vaccinations have gone by the wayside. As a matter of fact, the latest studies showed us that if we look at the vaccination over this period of time, we don't have enough people vaccinated with the routine child immunizations to develop a herd immunity. Everybody talked about herd immunity during COVID. They worried about a herd immunity for COVID prevention, but it's also we need to have a good herd immunity for routine prevention of routine pediatric diseases. So that's fallen by the wayside as a result of misinformation that was spread during this pandemic. And the other thing, because of all the back and forth, should children go to school? Should they not? Should my child wear a mask? Should my child not? Can I be around my friends? Can I not? Well, adolescent suicides have gone up tremendously during this time. And now we have this new post-COVID mental health thing. Anxiety is running rampant in the pediatric population. And the current recommendations now are to screen children routinely for anxiety well down into the lower ages. And somebody will say, well, how do I know if my child's having anxiety? Well, you're their parent. You know there's a change in their behavior. You know there's something different about them. The behavior you always see, like, I'm not going to worry about that behavior. But if it's a behavior that makes you scratch your head and think about it, is this a result of anxiety, depression, whatever? And then if you have that question in your mind, then by all means, take them to see your pediatrician. Pediatricians are still there to take care of all those things you want us to do before and during and now after the pandemic. And we also utilize telemedicine as part of that. So, we got to get our children back on board. We got to get their grades back up because they fell academically as a result of that. And somebody raised a question in the chat. What are some of the lingering effects of COVID when you're recovering? And I think Dr. Wingfield had a great information on it. He's probably going to share us a little bit later. But one of the things he may mention is called long-term COVID. And that is not limited to adults. We've seen a lot in children. As a matter of fact, we now know a little bit that the comorbidities that children have can contribute to those who will or will not get long haul COVID. So I'll kind of stop there and see if some of the other brothers want to weigh in.
Well, I appreciate that, Dr. Boykin. I think Dr. Wingfield, go ahead. We're not going to wait till later. Go ahead and chime in now, Dr. Wingfield.
Okay, I'll chime in on that because, that is something that we're all going to see. You're going to see more and more of these post-COVID clinics or long hauler clinics. Okay, and they're everywhere. Hospitals are advertising for long hauler clinics because what we see and the numbers, some studies have shown up to 50%. I think the number has settled somewhere around 20 to 25% of patients 4 weeks after COVID continue to have lingering effects of COVID, whether it's brain fog, whether it's respiratory issues in terms of continued shortness of breath, inability to get back to the level of function that they previously had. We see, especially in cardiology, we see so many patients with this sinus tachycardia where they have this fast heart rate. Heart rate now is over 100 consistently. Sitting, you can feel the palpitation, heart rate is over 100. Also issues with late blood clotting after COVID. So there is as well as pulmonary fibrosis, so scarring of the lungs for patients who've had COVID. So these patients are really struggling to get back to that level of functioning that they previously enjoyed. And one thing is, especially in a cardiology clinic, is we always get an ultrasound or echocardiogram to take a look at the structure of the heart. But also, I find myself referring patients to respiratory pulmonary rehab. So I really rarely sent patients to pulmonary rehab. And this is rehab facilities that help with increasing your level of function. So it's not so much, yeah, I got COVID, but it's that long hauler that can affect up to 50% of the people where you continue to have these symptoms. And I'm going to be honest, there's really the only treatment at this point in time is time. Okay, so we won't even run a stress test until 90 days after you've had COVID, because a lot of people just kind of hit the wall and it really can't go farther. So we wait at least 3 months to try to do anything to assess a functional capacity, just to allow the body to heal.
This is powerful information. Dr. Isabell, please chime in.
Couldn't even to add on what Dr. Wingfield said regarding long COVID syndrome. There are also patients who didn't have high blood pressure before. I've noticed in office that patients' blood pressures have been high, and they've been high for a few months. Then eventually it may normalize. But also patients that weren't a diabetic were not even considered pre-diabetic, or they didn't know. And I don't know, some patients in the hospital, they were treated with high dose steroids, and then some of them became full diabetics. So I've seen that. I've seen just chronic fatigue, the chronic cough, as well as go back to mental health, anxiety, depression. Patients just don't feel like themselves anymore. And that they feel very discouraged, and mental health is very important as emotional. And I've seen that, just to add.
We got Dr. Phillips and then Dr. Plummer. You follow after Dr. Phillips. Go ahead, Dr. Phillips.
No, I was just going to add on, you're also seeing a whole lot of neurologic changes, headaches, even mental confusion. Had a friend of my sister's who was a Harvard Business School grad who had gotten a dream job and got COVID, and then afterwards recovery, just felt like she was not mentally or intellectually able to compete in the way she was before. And that's something that you're seeing a lot, as far as these neurologic headaches, feelings of confusion, things of that nature. So again, I think long COVID is something that we're still discovering, as it was mentioned earlier. And I think, the one thing that I could say is, if you don't want long COVID, try not to get COVID by utilizing some of these preventive measures that are still available to help you in trying to mitigate your risk.
Dr. Plummer.
Just echoing everybody else's same statements. One of the things that I want to take care of is the misinformation about vaccination. I want to increase the female vaccination rate. It doesn't cause infertility. When you're vaccinated, you reduce the chances of stillbirth, miscarriage, hospitalization, ICU care. Also, you protect the fetus with antibodies, and also those antibodies can last up to 6 months after delivery, so it keeps the infant protected. And those are the most important things that I want at least women to know, that the vaccine is safe and they can get it in any part of the pregnancy or any trimester in the pregnancy.
Fantastic. This is powerful information. Dr. Boykin, do you want to add something?
Well, I was just going to add on to the fact what Dr. Phillips, and I'm going to come back to what Dr. Plummer said as well. What Dr. Phillips said about the neurological effects. Studies have shown during this pandemic that those children that were prone to get headaches, i.e. those children with chronic headaches, or those children with migraine, children can get migraine headaches and migraine variants, abdominal migraines and all types of migraines out there. They tended to be suffer more during the pandemic, had more episodes of headache. And those are also the ones that tended to have some other long-term COVID type effects. So the neurological things are not only in the adults, but they're in the pediatric population as well. And talking about the myths about vaccination, people always question me about, why should we be giving 6-month-old children vaccines? Well, the truth of the matter is, we don't know what child's going to have long-term COVID, which child's going to get very sick and die, and which child's going to have a mild case. We just don't know that. So I as a practitioner and I as a parent would rather have my child vaccinated against something that has been shown by studies to be safe and effective than take the chance of my child getting COVID and dying. And that's the same thing with the other vaccines out there. I mean, you hear all the time about MMR causing autism. That's definitely not true. It's been misproven many times over. Okay, but the sad fact, as I mentioned earlier, that because of this misinformation, children didn't get their routine vaccinations, and we're seeing now cases of measles on the rise again. There are cases of polio coming back. So please, people, don't listen to that misinformation. Get back in the routine with your pediatrician. Discuss with your pediatrician. I'm not here to beat anyone over their head about vaccination, but we know the statistics and the data, proves that vaccination works in preventing diseases.
Dr. Isabell, we're going to come to you next, but Dr. Boykin, since you brought it up, let's talk about just quickly. I realize we've talked about this many times before, but we have a new audience tonight. A lot of people tuning in for the first time. The vaccination, can you talk about it? Because you already said misinformation. There was talks that the vaccination will keep you from getting COVID, and we simply know that that's not the case. Can you talk to everyone about the vaccination, what it does, and what you can expect from taking the vaccine?
Yeah, it's a good question. First and foremost, there's no vaccine out there that I'm aware of, no vaccine out there will prevent you from getting sick. The whole idea behind the vaccination to prevent you from getting badly ill. Okay, so the vaccines, the COVID-19 vaccines, were designed to decrease the possibility of getting severe disease, hospitalization, and/or death. Okay, and we see that even with vaccination, that people got COVID again. So the vaccines are designed just to do that, prevent you from having the severe effects of a COVID-19 disease. And now we know that because of the Omicron variant, we have to have a new breed of vaccines. The original vaccines were called the monovalent vaccines, and you probably hear a lot about the bivalent vaccines. Well, these are the vaccines that not only protect you against the original COVID, but also against the Omicron variants. And we're seeing so many variants that are coming out here now. You still can get COVID if you're fully vaccinated, because the ability of these variants to evade our immune system. So the vaccines are just that. They prevent just severe illness, hospitalization, and/or death.
Dr. Isabell, do you want to chime in? Do you have something else to?
I'll add some. Dr. Boykin said the last thing, what I was going to say regarding decrease in hospitalization and death and breakthrough. But also I want to mention regarding rheumatology effects. Patients post-COVID sometimes get joint swelling. I've seen patients who had a foot swelling, ankle swelling. And then there was a question regarding, can exercise help with COVID? Well, if you have generalized weakness, muscle weakness, you may need physical therapy. I also do, like I said, I'm a DO and I do osteopathic manipulation treatments, which is techniques that may help with patients that may have increased chronic pain. Somebody who has chronic pain, sometimes their COVID makes their pain 10 times worse. And treatments like that may help them. But I do agree, I think exercise can help.
I just want to encourage all of our viewers that are watching, please utilize the chat feature to ask your questions. Want to give a shout out to Colonel Bracey. I don't think he's missed a session yet. He's always here with us. So Colonel Bracey, we appreciate you. Before Dr. Phillips, let me just ask Dr. Ford one question, because Dr. Ford, you mentioned it from the beginning of the show. I think we talked about it, but I think it's important because I think it ultimately potentially could lead to people, ending up either seeing Dr. Wingfield or any of the doctors as it relates to that weight gain. So what are some causes, as crazy as it might sound, what are some causes of weight gain, and what do you recommend during this time? Whatever caused the weight, what are some things people can do that will help them decrease their weight?
Well, when you talk about weight gain, really you're talking about nutrition, right? How you're eating. You want to try to eat more lean meats, more vegetables, cut back on a lot of the carbs. I think those things tend to put more weight on you. Obviously, eating a lot of sweets and pies and cakes and cookies and ice cream, and I think people over the pandemic were doing a lot of emotional eating, right? So you're stressed, you're depressed, not being able to get out. And so you tend to overeat and eat all the wrong things. So now trying to get back to, as I mentioned, more lean meat. Half your plate should be vegetables. And those things tend to make a difference in trying to help to get your weight down. But also, we want to get back to getting out and exercise. Okay. I think that, people were going to the gyms or you were working out at different places, and then all of a sudden you got shut down. But even if you aren't comfortable going outside to a gym or anything like that, your home is a great place to exercise. Okay. You only need a small room just to exercise. There are different things. There are sit-ups, push-ups, jumping jacks. You can get one of those little steps and go up and down the step, and those little step aerobic things that they have. So there's multiple things. You have to be creative. And so I think by getting the weight down, I think by exercising, eating right will help to reduce the obesity, and it help to reduce a lot of the factors that we, talked about, joint pains, help preventing people from going to pre-diabetic to diabetic, help people to get out of Dr. Wingfield's cardiac cath lab and for coronary artery disease. So those are just some of the preventive things that I think is important.
Dr. Ford, is there such a thing as too much of an aggressive weight loss? Is there, if somebody is working to lose some pounds, is there an ideal weight that they should be trying to lose, whether it should be per week or
I'm
per
hearing
month?
1 to 2 pounds a week is probably a steady weight loss. Okay. You don't want somebody to all of a sudden try to go to a diet that has, 300 calories in a day. You still want to eat, and you want to do something. And people would talk, and I hate to really say just you want a lifestyle change. You want something that you're going to do for the rest of your life, not necessarily lose weight 20 pounds in the next 2 weeks, because what's going to happen in the next 4 weeks, you're probably going to gain it all back if you haven't changed how you're eating, exercising all along. So I think that's important.
Dr. Plummer, you wanted to chime in?
Yeah. Sometimes also when you're sitting with the patient, you also got to look at their situation too, because sometimes I'm talking to them. I said, "Why is your diabetes not well controlled?" And they said, "Well, the things that I have to eat because I'm living in a hotel or I'm living in a shelter." So a lot of people don't have access to like fresh vegetables and everything like certain like other places. So sometimes you have to get social some social help involved so they can have the right, food, the right shelter. And also, during the pandemic, there was an increase in domestic violence. And there's an increase in domestic violence with pregnant women that is even much higher than when you're non-pregnant. So their social factors also are also important.
This is powerful information right here. Brothers of Omega Psi Phi, uplifting the community. Dr. Phillips, you have the floor.
No, what I was going to say earlier when we were talking about long COVID was, you're listening to all the different symptoms that you can have and the specialists involved. It is a pretty arduous process. And I think people need to understand that it's not a one pill takes care of everything. You may need to, as Dr. Isabell said, see a physical therapist. You may need to also be seeing a cardiologist or a pulmonologist or a neurologist, or maybe a combination of all of the above. But I would, again, still be very aggressive in pushing your primary care physician to seek those resources out, because everywhere doesn't have a long COVID clinic, which essentially does the same sort of thing as far as referring you to the specialists that are involved in a team that may be needed for your long-term care.
Dr. Boykin.
Well, I think Dr. Phillips and Dr. Wingfield both hit it on the head. It's not a one-shop physician type thing. It's a combination of specialists coming together to treat the long-term COVID. But I want to go back to the what causes weight gain just for a second, if you will. In my practice, I think the most important thing I always told my patients is that the first and foremost thing you don't want to do is start skipping meals, particularly breakfast, because if you skip a meal in the morning, guess what? The rest of the day, your body thinks, I need to eat. So you're driven to eat all day long. So you want to have balanced meals all day long. And first and foremost, never, ever skip breakfast. Moms, dads, don't let your children go out the house without something eating. If they don't have anything to eat, then give them something similar to that, because a lot of the kids went to school and got their free breakfast in schools and things like that. And then when the pandemic came around, all those programs were cut out. But good things, a lot of communities had those kids come by and get their meals anyway. But when you interrupt those things, if you miss a meal like that, like I said, you're more prone to overeat and do things like that. And as Dr. Ford said, it's a lifestyle change. You got to be committed for the long term. And I agree with him 100%. Parents say, how much should my child lose? No more than 2 pounds a week. And that's pushing it. And I would make them commit to that when they came in for it. But again, getting back to the long-term COVID, that is what we're going to be seeing for a long time in all age groups. So I think people need to take heed of that fact. If you got questions, talk to your primary care and get referred to the right people.
As I told all of you doctors, the time was going to go fast when we were having fun. Dr. Wingfield, in a little bit of time that we have, we got just maybe about 10 minutes left. What I'd like you to do is I'd like you to let's elaborate a little bit on blood pressure. We hear about it because it affects so many of us. Can you break it down for us like a fraction? When we hear high blood pressure, what exactly is happening on the inside, and why is it such a concern that we should be aware of our blood pressure and keeping it at a range that's acceptable or good?
Absolutely, that's a great question. When I hear the word blood pressure, the first thing that pops into my mind is the silent killer. Okay, high blood pressure is the silent killer, and the reason behind it is that blood pressure affects so many organ systems. Essentially, all of your organ systems are affected by your blood pressure, right? So what we want is a blood pressure of 120/80. And that's part of knowing your numbers. You should know what your blood pressure is running. And especially as we get older, blood pressure tends to increase. Vessels over time start to stiffen, start to harden. So we anticipate that your blood pressure is going to go up as we get older. But if you haven't had a physical since high school, right, it's time to get in there, get your blood pressure checked to make sure that your numbers are where they should be. And if not, you need to see your physician. In terms of numbers being where they should be, as I said, 120/80, in some cases 130/85 or less, okay? Blood pressure affects the brain. So it affects the central nervous system, increasing your risk of stroke. It affects the heart. It thickens the heart. It makes the heart more rigid and can send you into heart failure. It also increases the speed of cholesterol and atherosclerotic plaque buildup in the heart arteries, right? So that pressure helps to push that cholesterol into the blood vessels, causing blockages. It affects your kidneys. You go by any dialysis clinic, just peep inside and see how many young Black men are in there hooked up to dialysis machines. And that reason being is that for years, the blood pressure has been unchecked and untreated. African Americans, we just have, I mean, we're genetically programmed, okay, we have mom, dad, grandma, granddad, everybody essentially pretty much had high blood pressure. So we've got to be more aware of it and get it treated early because we know the effects of it.
And Dr. Wingfield, if you could, so just let's assume somebody, they're watching us for the first time. They haven't been to their doctor, like you said, since high school. So when you say 120/80, can you briefly just describe what those numbers mean? When somebody hears 120/80, what do those numbers mean?
Okay, so one is the top number is the pumping pressure. That is what your heart is pushing against. Okay, so when your heart squeezes, you're pushing against 120 pounds. Okay, now if your blood pressure is 180, your heart is pushing against 180 pounds. Okay, so imagine you in the gym, you working out, you bench pressing 120 pounds, not a big deal. Somebody dropped 200 on your chest, that's going to be a problem, right? So that's how I tend to explain that top number. The bottom number is how your heart relaxes. Your heart has to relax. It's a pump. It's got to squeeze and it's got to relax. So if your heart is stiff and not relaxing, that bottom number is going to be elevated. So bad. Okay. So the lower those numbers, the better off you're going to be long term.
Outstanding. Dr. Isabell.
To add to it, regarding hypertension, we know that salty food can raise your blood pressure, but sweets too. Patients think, aren't aware that eating a lot of sweets can also affect your, as well as your sugar, it can affect your blood pressure. So what I'm saying, you have to change your diet. And a quick thing, yes, everyone still is recommended to get the flu shot because we expect with the people are more out doing regular activities. So we expect the flu season to be high this year. And lastly, to long-term COVID clinic, most of the major corporate hospitals have COVID clinics. There's ways that you can find it online, or the best thing, ask your primary care doctor.
Outstanding. Dr. Boykin, you wanted to add something to that?
Yeah, I was going to say, Dr. Isabell hit the nail on the head about the flu vaccine. Please, 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 please get your flu vaccine. You get your flu vaccine up until June. You know, there's no reason why you can't get even that late in the day. But from my perspective is that the number one victims of flu are the young children and the elderly. So we need to get our children vaccinated for the flu vaccine.
Dr. Plummer, I want to talk to you in a little bit of time that we have left. Can you, just as Dr. Wingfield eloquently describe blood pressure for everybody, assuming that we have some people here, they hear the term diabetes. They hear the term type 1, type 2. They even heard you reference a different type of diabetes as it relates to pregnancies. Can you just briefly talk to us about diabetes and what exactly is it? What is type 1? What is type 2? And share that information with us.
Well, type 1 diabetes is when you actually make no insulin whatsoever. And obviously you need insulin to live. So these people have to take insulin for the rest of their lives because their pancreas is not making insulin. Type 2 diabetes is when you do make insulin, but your body's insensitive to it and it's usually more common when you're older and when you're obese. But as what Dr. Boykin says, he's starting to see that much earlier, and even in children. When it comes to pregnancy, when you don't have controlled diabetes, it leads to complications in the pregnancy. It could lead to fetal malformations. The baby becomes abnormal. It also can affect the baby's heart. So one of the things we want to make sure is women that if they do have diabetes, that they get that under control. And one of the things of keeping it under control is by the hemoglobin A1C. Generally, as the blood travels in there, it picks up glucose on there, especially if it's uncontrolled. And ideally, we usually like our hemoglobin A1C to be 6 or less before they get pregnant to reduce the amount of complications in pregnancy. So please get your prenatal care, get your blood pressure screening, and yes, pregnant women can get the flu vaccine without any issues.
We talked about blood pressure. We talked about diabetes. There was another thing that the doctors mentioned as it relates to their physicals and the results, and that was cholesterol. So, Dr. Ford, Dr. Phillips, anyone want to give us a little bit of information on cholesterol, what it is, and all that? Well, Dr. Phillips?
I guess what I would say is cholesterol is the stuff that can block up your pipes, just the real basic way. You've got different types of cholesterol when it's looked at. And again, when you're getting your cholesterol checked, make sure that you're fasting, which is not eating for at least 8 to 12 hours before. Cholesterol numbers of concern should be when you have a total cholesterol above 200, a triglyceride level. Triglyceride is a bad cholesterol. You want that less than 150. And then the LDL, which is also bad cholesterol. It depends on what your health issues are, because the number can be less than 130 or preferably less than 100 if you have conditions like diabetes. And you also have what they refer to as the good cholesterol, which can be elevated by eating healthily. Also in exercising can raise your HDL, and we like that number greater than 40 or 45. So again, cholesterol is something that's important to get checked, as Dr. Wingfield said, as when you're getting that physical exam, to know your numbers. And again, we're not here to push medicines on anybody, but if you're going to take a holistic approach or an approach that involves medication, you want to know what type of numbers you're working with so you can construct a plan that's most effective for the health issues that you may be dealing with. If you have elevated blood cholesterol, you want to make sure if they've started you on medication, because medications can have some side effects like muscle pains and fatigue, that you have a follow-up plan to make sure that you're tolerating the medication. Because unfortunately, a lot of times individuals, if their medication doesn't agree with them, they just stop it and they don't tell the doctor, and then they go back to the doctor. And unfortunately, the issues that can be negatively impacted by the cholesterol not being controlled don't care about the fact that you had side effects, because there's some other options that you can come up with to manage it with your doctor. But again, cholesterol can lead to heart attacks. It can lead to stroke. It can lead to peripheral artery disease. It can also contribute to dementia and Alzheimer's conditions. So again, it is something that is very, very important. And unfortunately, with obesity also running rampant in our community, as it was mentioned earlier, it is a problem that we need to be very, very mindful of.
Outstanding. Well, it certainly has been a time. We're at the point now at the show where we're gonna have our closing remarks from each of the doctors. Again, I want to thank all of you for taking the time to uplift our community. One thing that we're definitely going to be doing is every month, the last Wednesday of every month, we're going to be right here answering your questions, providing uplift to the community as it relates to health and wellness, because it's important that we want to make sure we understand our health and we understand what it takes to be well. So with that being said, we're going to start off with Dr. Isabell. If you can give us your 1 minute or less closing remarks, and you have the floor, Dr. Isabell.
Thank you. Well, first, I'll just go my closing. I was going to mention regarding the LDL. If you're diabetic, they like it less than 100. Cardiologists, heart disease, they like it 70. So I'm an osteopathic physician, and I like to, in the future, let people know about osteopathy DOs, that they make up 11% of the physicians in the United States. We can practice any specialty, such GI, cardiology, infectious disease, general surgery. We're all over. A lot of you probably don't even know that your doctor may not be a DO. Every DO doesn't do osteopath manipulations, so that's probably why you don't know. I also do HIV primary care and Hep C, in which I'm in preventive or screening for that from ages 13 to 64. A lot of people don't know their status, even with Hep C. And so I like to, in the future, let people educate and awareness regarding that. I also do inpatient care. I see a lot of complex patient knowledge, and I'm just here to help make everyone aware in their well-being. Thank you.
Thank you so much, Dr. Isabell. We're going to move now to Dr. Ford. And Dr. Ford, make sure you share with everybody what you do or what's coming up this weekend. Dr. Ford.
Okay. Just like to say, first of all, just appreciate being a part of this health and wellness for the 2nd District. Wanted to just stress that everyone should definitely try to connect with your primary care physician to get up to date on all your screening tests, get your vaccinations, and also to let's get moving so we can to help control weight, cholesterol, blood pressure, diabetes, so we can help to try to control and prevent some of these chronic diseases. I'm a member of the Health Initiative Committee for Gamma Pi chapter of Omega Psi Phi, and I'm the chair. And we're going to be on October 29th. We're going to be working with one of our brothers at the University of Maryland, brother Coach Loxley, and his group to help with mental health. There's a big forum there. It's actually an in-person forum for mental health. So that's what we'll be doing in October on 29th. We have some upcoming webinars also on every fourth Saturday. The next one, we're going to actually have a vaccine webinar also in, I believe it's actually in December. So just like to thank everyone again, and looking forward to next month.
Thank you so much, Dr. Fo. Really appreciate you and all that you're doing. Let's go to Dr. Plummer.
All right. Thank you for listening this evening. This is October, Breast Cancer Awareness Month. I just want you to be aware that 1 in 8 women will develop breast cancer in their lifetime. Black women have a 40% increased risk of death compared to white women. The best thing to do is to discuss when you're at the age of 40 with your doctor about breast cancer screening. And at least at 50, you should at least have your first mammogram. The most important thing that I want to know for women to know is to get their primary care from their doctor, to get their blood pressure under control, their diabetes under control, get their vaccinations, get their COVID vaccinations, their flu vaccinations, because I want them to know that a healthy woman will have a healthy pregnancy. And that's the whole goal of everything, to reduce maternal mortality and morbidity. And thank you.
Thank you so much, Dr. Plummer. We're looking forward to seeing you again next month. Appreciate you for being with us on tonight. Let's go to 78. Dr. Boykin, you got it.
Thank you, brother IPDR. Well, I just want to say I have enjoyed tonight, and I hope all of you out there have enjoyed it. And I want to say to each and every one of you, please listen to these brothers. They gave you some great information tonight. And I'll say for you parents, take care of yourselves so you can take care of your children. But let's resume what we need to do. Now that the pandemic has come to a point where we can start getting back in this lane, let's get back into well child care, well child business, and re-engage with your pediatricians. Let's get our routine vaccinations back up to par so we can get our community herd immunity back up to par. And also, please get your child's flu vaccine. As I said, the young child and the elderly are the biggest victims of the flu every year. And recognize that anxiety has become now a standard problem in the pediatric population. So if your child's having signs of anxiety, engage with your primary care. And I say pediatrician because this is what I do, but Dr. Phillips he takes care of them as well. So, engage with your pediatrician or your family practitioner and get back on track with your well visits. And make sure your child eats properly, because as I said before, don't send your child to school hungry, because if your child is a little bit overweight and they tend to miss meals, then they'll be in a state of thinking they need to eat all day and then be having empty foods for empty calories. So please stay engaged, and I hope you come back next month as we continue to have these things. So thank you very much.
Outstanding, Dr. Boykin. Thank you so much, as always. Let's go to Dr. Wingfield. Dr. Wingfield, your closing remarks.
Thank you so much. And once again, it was a pleasure. This was great exchange. So again, thanks for having me. So my closing statements is one thing that I preach to all my patients. Make sure that you have a primary care. The primary care docs are your gateway to health. And we should all re-engage with a primary care provider to treat conditions. Preventative medicine, as we say, an ounce of prevention is worth a pound of cure. So we have to be cognizant of PSA checks, prostate exams, mammograms, GI, colonoscopies, those things, the whole holistic approach to medicine. One thing I also stress is, when do you see a cardiologist? I recommend that you see a cardiologist if you have one risk factor for heart disease. If you've been diagnosed with hypertension, you need to see a cardiologist. If you have diabetes, you should see a cardiologist. If you have kidney disease, see a cardiologist. Or if you have a family member who had a heart attack, a parent, a father, a male father, grandfather who had a heart attack before the age of 60, a mom or a grandmother who had a heart attack before the age of 65, that increases your risk for sudden cardiac death or having a heart attack. So those are the things that we certainly want to get across tonight. And the last thing, one thing we alluded to, taking medications. You have to I urge my patients all the time. Look, if you have to take one medication, okay, to prevent damage to your body, damage to yourself over time, just taking one medication is going to be far better than the risk factors or the side effects that we're somewhat concerned about, right? So, of course, patients always talk about, well, these side effects. The damage that you do by not taking medications is far worse than those side effects. Okay, so thanks again. Looking forward to further exchanges next month, as Brother Boykin stated. Have a good night.
Outstanding. Thank you so much, Dr. Wingfield. And yeah, I think that's something that we're definitely going to chime in on next month with medications, because it is important. Last and certainly not least, the chairman of the 2nd District Health and Wellness, he put this all together. And so we salute you, Dr. Phillips. The closing remarks, sir.
Well, I'd first like to say thank you to all my brothers that agreed and answered the call to participate in this initiative. I think what we have looking ahead of us for the Health and Wellness Committee is some great information. I think information's been a critical issue during this pandemic. Information has exposed how skeptical we are about the medical industry now. We are still dealing with a legacy of disrespect and mistreatment from the medical industry. And I think that unfortunately has created a fertile space for misinformation to be put out there, and also mistrust. Again, we might have saved 200,000 to 300,000 people if we had more people that were vaccinated, possibly. But the point I'm making in saying that is we need to get in this space. And when I say we, I mean physicians of color, African-American male physicians. We need to be in this space. And that's the challenge that myself and the rest of my brothers have taken upon. And we're going to be part of this curriculum of different topics that will come to us throughout the year to help us be the healthiest that we can be, so we are not the low-hanging fruit for the wrong reason. So with that, remember, as Dr. Wingfield said, and I'll say it a different way, prevention costs us a whole lot less than reaction. And with that, I'll yield my time. And brother, immediate past district representative, we thank you so much for your enthusiasm. And behind the scenes, our wet guy who takes care of all the details and the wet work in the background is Brother Piercy. We appreciate you as well, my brother. Thank you.
Thank you so much, Dr. Phillips. We appreciate you. We appreciate all the doctors that joined us on tonight. And certainly, as we always do before we leave this place, first and foremost, we want to show love. We want to give a shout out to our current district representative, the 38th district representative, Brother Del Rico Gales, our leader. So we certainly salute him. And last and certainly not least, our Grand Boss List, the 42nd Grand Boss List, Brother Ricky Lewis, who is the leader of the entire Omega Psi Phi fraternity. We want to salute them for their leadership. As I always say, as we leave this place, please make time to schedule your time to donate blood. It is so critical. It is so critical. Our fraternity brother, Dr. Charles Drew, it was critical in getting us to the point where we can donate blood. So please make sure you schedule the time and donate blood. You've heard the stats tonight as it relates to breast cancer. So certainly for Breast Cancer Awareness Month, we want to make sure that you are involved, you are engaged. Please find the program, support breast cancer awareness. The next time that we meet, we would have passed the elections. And so the time to get out and vote is now. If you are not registered, please make sure you're registered to vote. But most importantly, on election day, go out and vote. Certainly, we want to keep in prayer those that have suffered from Hurricane Ian. And I want to suggest, if you have not already donated, if you have not already contributed to assist our communities in the Florida area that were impacted by Hurricane Ian, please, you can visit that link, make a donation. Let's assist our brothers, our sisters, our family members that are down in the Florida area that have suffered as a result of Hurricane Ian. You also heard about Domestic Violence Month, so certainly we want to make sure that we are aware as this is Domestic Violence Month, and certainly we want to continue to support those programs to limit, decrease domestic violence. Last and certainly not least, to all of my fellow Libras, we want to say happy birthday. If October is your birthday month, we certainly want to salute you and honor you. Happy birthday to you. And until we see each other again next month, continue to stay safe and continue to stay well. My name is Brother Kelvin Ampofo, the immediate past district representative of the mighty 2nd District of the greatest fraternity on this side of glory, the Omega Psi Phi Fraternity Incorporated. Thank you so much for joining us. We'll see you next month.